cap the cost of insulin for Iowa residents on those state insurance plans.
The organization says the federal government already has a cap for those who use Medicare Part D, but there are gaps for those on state insurance. KTIV's Matt Hoffman spoke with the AARP and an Iowa doctor about their efforts to limit the cost of that drug.
The AARP says almost 250,000 Iowans use state-regulated insurance. And for those who use insulin, there's no cap on the cost of the drug.
Such a cap has been passed in the House previously in 2021. It has received broad bipartisan support in the past, and we believe the time has come to get this bill to the finish line.
Dr. Anuj Bhargava, an endocrinologist here in Iowa, says an insulin cap isn't just a want, it's a need. He says 1 in 4 patients are rationing insulin because the drug is too expensive.
What I say is simply this: this is not acceptable. We are in the United States. We're in the great state of Iowa. It is simply not acceptable that people are finding it hard to afford insulin.
An AARP spokesperson says the State House passed the insulin cap bill in 2021 with only 2 lawmakers voting against it. But the bill never made it to the state Senate floor, and so it never became law.
Americans continue to pay the highest cost for insulin in the entire world. And again, insulin has gone up about 600% in price over the last 20 years.
An AARP spokesperson says any insulin cap for private insurers, that's those who don't have government-sponsored health insurance, will need to be passed by the federal government. In Sioux City, Matt Hoffman, KTIV News 4.